Hip arthritis is an incredibly debilitating condition that will stop us from doing some of the most simple activities of daily living, such as going for a walk or just getting out of your chair. This condition will often present pain around the hip, so that's often in the groin or around the buttock on the side of the affected hip. And this is a degenerative process, which means that as the process starts to get worse, you'll start to get a degeneration, so a wearing down of the joint itself and a narrowing of the space within the joint. As a result, you get a buildup of inflammation within the joint, and that's usually what causes the pain. Now, just because you've got arthritis in a joint doesn't mean there isn't anything that we can do besides surgery. There is lots of things that you can do to prevent this from getting any worse and to reduce the pain so you can get back to what you were doing before you had the problem. So in this video, I'm going to give you just some of the things that you can do. So stick around to the end to find out what they are. Let's begin. Hello, my name is Dr. Stephen Hume. I'm a chiropractor currently based in Didcot, and in this video we're going to be looking at hip arthritis. And if you're somebody that's suffering with pain in the hip, then this is going to be the video for you to help you to decrease that pain and help you get back to the things that you need to get back to. Now, the first thing I'm going to suggest, and this is not one of the 3 exercises, is to go see a chiropractor. Hip arthritis is something that I see very, very commonly in clinic, and there's a lot that we can do in the office manually to decrease the pain. What we can do manually is to improve the function of the hip, but also of the back and the surrounding areas to take the pressure off that joint, which will then inevitably reduce that inflammation and help you feel better and get you more mobile. So if you haven't seen a chiropractor yet, then you're doing yourself a disservice. So go see somebody that can help you further. Now, having said that, these 3 exercises is a good place to start, or exercises that you can do alongside therapy with the chiropractor. So the first one is going to be a distraction exercise. One of the processes that happens with hip arthritis is a narrowing of the space within your joint. So this exercise is going to help to open up that space to help decrease that inflammation and therefore help reduce the pressure within that joint. So what you're going to do is stand on a step with your good hip. Then with your arm on the same side as your affected hip, you're going to hold on to something like a stick just to stabilize yourself. And then you're just going to let your leg hang in the air. The weight of your leg will help distract that joint, so help pull that joint apart and open up that space. And then what you can do from there is just swing your leg up and down very, very gently. Make sure that it's not making it feel worse and work within the pain-free range. Don't need to do too much motion, just a little motion up and down. Now, if you want to increase the amount of weight, then you can start to put some weight on your ankles to help pull that hip apart even more. And you can stay in this position for as long as you feel comfortable. I would suggest start at around 20 to 30 seconds and then do a few sets of that. So you're getting a few breaks in between. And then as that starts to get easier, then you can start to do more. What I would suggest, like a lot of exercises that I suggest, is to do it frequently rather than a lot all in one go. Now, the second exercise is going to be to bring your knees side to side. This is a very simple exercise, often given by chiropractors and physios for low back pain, but also hip issues. And you're simply just going to be lying on your back, feet flat on the floor with your knees bent, and you're going to just rock your knees side to side. That's just going to get some gentle movement within the hip that you can control without too much weight or pressure going through it. Again, I would suggest do this around 20 to 30 seconds at one time, and then do a few sets of this. Now, my third exercise is not really an exercise, but it's going to be something again to take the pressure off the hip, and that's going to be to use a cane. I know that a lot of you, particularly as you start to get a bit older, can be a little bit resistant to a cane just because it can make you look a bit older. However, this is something that can be very effective and can just temporarily take the pressure off that hip. So it doesn't necessarily mean you have to use this forever, but just as the hip is in a bad state, you can just use it to decrease the pressure on the area, and a lot of the time you can start to feel a lot better, and that's going to be a lot better than worrying about how old you feel, hopefully. So just a quick tip on how you use a cane. What you want to do is put it in the opposite arm, and then as you stride forwards with the affected hip, you're going to bring the cane forwards at the same time. So as you're putting the weight on that hip, you're also putting the weight on your cane so that the pressure or the weight of your body is being spread across your hip and the cane, so there's less weight going through the hip. Often this isn't that difficult. If you just walk normally with the cane, you'll start to get used to the rhythm of it, but that's generally what you want to do. So you want to make sure that you're using the cane at the same time as putting the pressure through the hip, so you can decrease the pressure through the hip. And essentially everything that we're doing here is to decrease pressure in the hip to avoid aggravation so that we can decrease the inflammation. So do give these things a try. Hopefully this is going to help you, and hopefully this will start to help you get back to what you were doing. I know this can be a very frustrating condition. If you were to implement these exercises, and if you were to go see a chiropractor to get the function of the hip and the low back improved, a lot of the time you can actually delay the need for surgery, or in some cases prevent it altogether. So do start here, just because there's no drawbacks to this. It's not invasive. All it requires is your time and your discipline. So give it a go and let me know how you get on in the comments below. If you are new to this channel and you are liking some of this content, then please do hit that subscribe button below. If you want some more exercises on the hip, I actually did another video almost a year ago now on hip movement exercises, mobility exercises, and these exercises can also be very good for hip arthritis. So check that video out here after you've tried these exercises. Take care, and I'll see you on my next video. Bye bye.